Hi, and welcome to Pet Talk with Dr. Lee, and I should add, and Dr. Bernadette. I'm John Mondelli, and the Dr. Spector from Gray Fox Animal Hospital with us again and for another show. And actually, I should have introduced AJ as well. You're a 2-year-old
toy poodle.
Toy poodle. I knew that. I was seeing if you knew. And today's topic, by the way, we're going to talk about allergies and flea and tick control. First topic, or first segment, we're going to talk more about allergies, and not the allergies that I might have towards a cat or dog, which I do have and is very real. You don't believe me, but the allergies your pet could have.
Correct.
So who wants to touch on that first?
I will.
You, Bernadette, go ahead.
I'm going to talk to you about how when I see a patient, when they come in, I look at the patient and I see where the problem is. I listen to the owner, how long it's been, and then we take it from there. There are many types of allergies. First, there are inhalant allergies, and in that category, then you have the contact allergies. You have flea and tick bite allergies, like flea bite dermatitis, which Lee will talk about later, and we have food allergies. So all those things come into play when I have a patient that comes in. I usually do an allergy consult. When I do that, it takes about 30 to 45 minutes, and I actually ask owners to bring a tape recorder because I go over so much, because we have so many products that can deal with the problems, like we have out front here.
I see that. That's a lot of product. Let me ask you, if I'm a pet owner, what are signs I would look for to know if my pet had allergies?
Okay, scratching is the number one. Big. They scratch, they're itchy just like us. We scratch. Mainly humans will sneeze and we'll cough, or we get congested if we have allergies. I'm actually allergic to dogs, cats, and dust. I became allergic when I was 30 years old. And in my case, it's not hereditary. It was because I was exposed to so much, so often, my body just said, that's it, you're getting allergic to all of this. But I learned with all of my allergies how to help my patients, because us as humans, when we're allergic to cats, I learned we're allergic to the A and B proteins in their saliva. And when they lick themselves, that dander goes up, we breathe it in, and that's when we get the allergic reaction from them.
So how do you handle that, by the way? I know I'm going off topic, but so how do you handle working with cats? I
actually had to give myself allergy injections for years, and then I slowly hyposensitized myself, and we do that with our patients too, with our dogs and our cats. We can do that. We've learned now over time how to treat them differently, but I'm still allergic to them. I haven't still. But it's not as bad. Like him, now he doesn't shed, so I'm not allergic to him. Some cats I'm allergic to because some of the A or B protein in their saliva gets me congested, so I will go in a room and I can tell right away. My nose will start to run and my eyes will start to water. I just go out, blow my nose, come back, and I'm good. And I'll take an antihistamine later on that night, and I'm okay.
Right. Let's get back to
But we try to avoid the problem. So I'm not going to touch a cat and rub my eyes. But with our pets, we can't keep them from going outside on the grass, which they could be allergic to, or the pollen in the air, which they could be allergic to, or the food. So we learn how to feed them the right way or with the proper food. So I call it a reactive food, just like milk is good food, but some people don't have the enzyme to digest the lactose, so they can't drink milk. They have to drink lactose-free milk. So some animals can't eat beef or other products, so they have to eat other foods, so that's not a reactive food for them.
I want to keep both of you involved, but is this a common thing with pet allergies, or has this been going on for years? And
pet allergies are very, very common. It's one of the most common things that we've seen throughout our practice. Probably the most common type of allergy, which you will discuss, are the seasonal allergies, to pollen, dust,
just like
the primary one. When I come in, when I do allergy testing, if someone wants to know what their pet's allergic to, I take a blood test and we send it off, and I test for 40 different allergens on the East Coast, which are trees, weeds, grasses, humans, wool, cat, dander, molds, dust mites. Dust mites are horrible because they're ubiquitous. They're everywhere in our homes, in our carpets, in our beds, in our pillows, everywhere. And mold. People think mold, oh, my house, your house isn't dirty. Mold is everywhere. It's under leaves in the fall. So those are the things that the animals have to deal with out in the environment. that I test for. And then once we know what they're allergic to, then I decide on which products to use to help them get relief from this. But the number one thing is scratching, itching. So when I have someone come in, I actually ask them on a scale of 1 to 10, how itchy is your pet, being 10 is the itchiest at home and 1 or 0 is nothing. And what are they doing? Like scratching their ears, rubbing their eyes, chewing their feet. A lot of dogs, they'll come in, I'll know right off the bat if they're licking their feet because their feet look rusty, especially if it's a white colored dog, because that saliva does that.
I come in, my dog's or cat has an allergy. And if I was going to come in,
the other thing we see a lot, people come in and say, "Oh, my dog stinks. I gave him a bath and he stinks." Number one, the skin is infected from them scratching and from the allergen, and ears. The skin that's out here is the same skin that goes in the ears, and those ears, once that barrier is broken, your skin is your protective barrier. Once that's broken here or in the ears, secondary invaders come in, such as bacteria, which are out there, and yeast. And they get in there, and boy, they make those ears stink, and the skin stinks because it's infected.
Now, if I come in, and if I came in, obviously it would be with a dog, not a cat, but probably wouldn't be either, but just saying, odds are. But if I did, from our initial consultation till the time we have we solve the problem, what is that time period? Does it vary?
It varies. Oh my God, it varies. It varies on the problem. Some problems are really easy. Some people come in for a consult and I say, no, this is just a mild seasonal allergy, or I can tell it's a contact allergy. Their pet laid on something that gave them a rash, and we just take care of that, as opposed to, it has to be, I look at the location where it is on. A lot of people come in and their dog's chewing at their butt. Usually that's a flea bite allergy. When they're chewing at their, and sometimes it takes one flea, they jump on them, bite them, and poof, the skin goes crazy. Just like you get a mosquito bite you, and it flies away. And you are scratching your arm. That's what that dog's doing to his butt, or the cat if they have a flea bite allergy.
So if you have an itchy dog, okay, and they come in and you suspect it may be allergies, which it often is for an itchy dog, and you figure it could be environmental allergies, seasonal, could be food allergy, could be flea allergy, the three that you mentioned. How do you initially decide which one it is, and how do you go from there? And do you treat them medically first, or do you go with testing? What's your approach?
Oh, well, first I do a physical exam to find out which one it is. If I don't find any fleas, and I find out where it is. If the dog's licking his paws and he walks in and his feet are all itchy, I know it's not a flea bite allergy because fleas don't go there. But if the dog is chewing his butt, I'm going to check there, like the top of his butt, not the butt, but the top of the butt, because dogs sit in the grass and fleas just jump right on and go at them. I look at the area, and then we see. If I see fleas, I got to give that dog or cat relief because they're just going crazy. They're itching so much, and that's horrible. They can't even sleep. So we treat them for the itch and the problem that's going on. Then we teach the owners how to prevent this from happening again if it's something like that. If it's a seasonal allergy, we got to give the dog relief also. So we give them some of these products that we have here. But if the owner wants to find out which seasonal allergy it is, then we do the allergy blood test. We recommend that while we're giving them relief, so then we can see which product's going to help the dog or cat long term. Because if they have these allergies, just like me, they're not going to go away, and I'm going to be exposed to these things just like the dog or cat's going to be exposed to the environmental allergens. If it's dust mites, they're going to be exposed in the house all the time. And I explain to owners, they can get like rainbow vacuums. They eliminate certain things in the house to help the pet to lower the dust mite population.
How about injections? Would that work for allergies?
We do allergy injections, but we've learned over years it treats them about 70% of the time. And people do allergy injections, and they're very good, just like I gave myself. I had to hyposensitize myself, and I was amazed how incredibly it worked, because my nose would be running. I'd give myself a shot. Within a half an hour, I would like dry up. I'm like, wow, this is great.
Wow.
And a lot of times it helps the animals like that, but you have to judge and look at the animal and see, or what the person wants to do. Some people don't want to give injections. They would prefer to give the pill or use something topically on them. That works for them better. And we do have products that we start off with. We have a new one out. It's called Apoquel. It's recently been out. It's the latest product where it stops itching, but it works on the receptors in the brain that tell the skin to itch, not like antihistamines that work on the skin. And this one's pretty good. Now we use this, we just give it twice a day for 2 weeks, and then we give it once a day indefinitely. and they may have a little breakout where their skin gets an infection, and then we have to work on that. Right. But that's the easiest one. So I have to see what the owner and the client wants to do and what they're capable of doing. I don't want to overload them, but I want their pet to get relief.
Now, if they come to Great Fox Animal Hospital, do they ask for you? Do they ask for Bernadette, or any of your doctors that your veterinarians could handle the allergies?
This is such a common problem that we all deal with them.
Okay.
So what we usually do is we go about it, treat it medically with antihistamines, which are usually the safest medication to treat it. And then we may follow up with some other medication if that's not working. It may be a steroid, which work very well but are not safe long term. Or we may use the product Apoquel that my wife mentioned, and several other products that are used long term, safer than steroids, and they're used for long term problems. Now, if it turns out to be something that gets really hard to control, most of us are going to refer it over to my wife, who I call at home Dr. Spector for short. But we refer over to her because she does the allergy testing and will do the detective work that's necessary to figure out exactly what they're allergic to and what sort of program they're going to need to do to keep the medications lower so they don't need to do quite as much medicating.
I really, you have to be a detective, and sometimes I'm the pain because I have to get into it and really to help
I like
the
the
pet.
fact when you said you talk to the people for at least a half hour.
I do that.
I mean,
and I tell them to bring a tape recorder. I said, because when they leave, they go, "Oh my God!" I'm like, I said, "I told you," because I'm trying to teach you everything I've learned in the past 30 years.
Right. No, I like that about my family doctor does the same thing every year when I go for my physical. We'll sit down for a half hour, and I think that's great. No matter if it's me or if it's...
We're not just veterinarians. We are educators, and we try to teach our clients things because they come to us. They want to learn how to take care of their pet and help them. So we're trying to teach them about all these things.
Talk about your products. What do we have out there? Like what types of things? Obviously, I see pills.
Okay, so first, the pills that are out front is Benadryl. We have two different kinds. You can get Benadryl in the store, 25 milligram. That's for itching, but we carry the stronger one, 50 milligram. Then we have those are antihistamines. Then we have another antihistamine called hydroxyzine.
So Benadryl, just like I would take?
Yes, just like you would take. And we have hydroxyzine, which is a different type of antihistamine, which is stronger. And then we have also chlorpheniramine, but I don't have that out there. That's another antihistamine that we can use on cats and dogs, and that works really well. That's what I take when I get stuffy at night from the cats. Okay. We also have Atopica, which is down there. That's for cats. And we have cyclosporin, which is the generic form of Atopica for dogs. These are long-term now, like Lee was talking about, because they're safer than steroids, because you really don't want to give your pet steroids for a long time. It can cause a lot of problems like Cushing's disease, diabetes, and you don't want that. So these are actually safer for that long term. And then we have the Apoquel down there. It's a small bottle. That's another long-term new one that I told you about. Also, canine omega benefits. That is an omega-3 fatty acid, which they have found really helps improve the skin, joints, hair coat, and the heart in pets and people. We actually can take the same product. These two bags of food here, the one on the right here, or next to me, that's Ultra ZD. That's what we call an allergy-free food. What that means is every time we eat something or a pet eats it, these food particles break down into particle sizes called Daltons. Anything that's the animal's allergic to will be larger than 10,000 Daltons, so the body knows that. This food is hydrolyzed, and that hydrolyzation process breaks it down into lower than 10,000. Actually comes into the body like 8,000 Daltons, so it literally flies under the radar. Even if they're allergic to chicken, which there's hydrolyzed chicken in that, it will not, the body will not react to it, so that makes it allergen-free, the hydrolyzed product. The Derm Defense, which is the further away from me bag, that's a fairly new product. It works on the barrier, your skin barrier. It keeps the skin more intact, because when the skin starts to fall apart and get these openings in it, that's when your secondary invaders come in, the allergens, the bacteria. And now we know that that keeps your skin stronger, and it's less likely to have reactions to allergens because of this food, and it's very good, prevents the itching and helps that. So if you have an itchy dog, that's one of the easiest ways to take care of them. You start them on the food and see how it does.
How about bathing? And like, would that help, or
Yes,
is that?
it does help. So if you have a bacterial infection, we've learned that just antibiotics don't do it, because people have used so many antibiotics that now the animals and the bacteria become resistant to these antibiotics. So we do antibiotics and some of these shampoos that I have out here. The one shampoo, it's chlorhexidine and miconazole. That takes care of the bacteria and the yeast that I was talking about that gets on the skin, so it washes them off. It really gives them relief, gets that off, kills them, with the antibiotics also internally. So we're doing internal and topical. When they're really itchy, the two products on the right, they're shampoos. One has pramoxine and hydrocortisone, which really relieves. Pramoxine is a topical anesthetic, and hydrocortisone gives relief to the itching topically, so that helps a lot. And then the aloe really helps. That shampoo, Lee's going to talk about that with the flea products, because a lot of people don't realize these flea control products, they're waterproof, but they're not detergent proof, and a lot of shampoos have detergent. You have to look at the bottle and make sure the bottle says detergent free, and that's what this aloe shampoo is, detergent free.
Now, these products you would get where? From your vet?
At your vet, because they are prescription items. You can't just use them, because people do use them incorrectly, and you can actually hurt the animal and cause more problems.
Look at a question. Cats or dogs, who's more apt to get allergies? Is it 50-50, or since I would think dogs are outside more than cats?
Dogs seem to get more allergies, and it depends upon the breed. Certain breeds really, really are affected. West Highland Whites are really affected.
Should you stay away from getting a dog?
Bulldogs.
Bulldogs are our #1 allergy patient, because that's genetic. So if your mom and dad had allergies and they had you would have allergies. It's just passed down genetically, and we see that a lot in our bulldogs.
And we see the flea allergies too. You'll see in a household very often you'll have 3 cats, 2 dogs. The dogs both have flea allergies, tearing themselves to shreds. The cats have just as many fleas and are running around pristine, like they're not bothered at all. So flea allergies, there are a few cats that do have flea allergies, and those poor cats really have crusts all over themselves. They look really uncomfortable, as they are. But we see it more in dogs than cats. Some cats, though.
Okay. Well, you brought up fleas. We're going to take a break. When we come back, we're going to talk about flea and tick. So stay with us. We will be right back. And welcome back to Pet Talk with Dr. Lee. I'm John Mondelli, joined by Dr. Bernadette Spector and Dr. Lee Spector and AJ, of course. I'm not going to forget AJ. Look, AJ even waves. That, I better tell you, you know how they say you never want to work with pets and kids? That is not a lie. that is a lie, I should say, because that dog is just unbelievable.
Oh, thank you.
Look at that. He's not too thrilled with me. He's yawning, so I guess I'm not keeping him excited. Anyway, Lee, we're going to turn to you for a lot of the next topic, which is flea and tick control, but we're going to focus mostly on fleas.
Correct.
So why don't you get right into it? What should we know about that?
All right, this relates to our last topic. My wife was talking about itchy dogs, primarily about allergies. But one of the big things that can make you itchy are fleas, either just because they bite you, or because, as is in the case of many, many dogs and a number of cats, they can be allergic to the fleas. So the fleas cause a problem in that they make the dog extremely uncomfortable. In addition, they can carry some diseases. The main one we see is this flea allergy that I was talking about. And in those cases, we see dogs and cats that typically are missing lots of fur, have crusts on their bodies, usually towards the back end.
So that's easy to diagnose, I would imagine. Is that like the easiest? We talked about that last segment.
Usually, because...
Get the flea comb and go right through. Ooh, there's a flea.
Oh, okay.
Right. And the difficulty is they could have other problems on top of it, so then that's where the detective work comes out. The other thing that fleas do is they'll transmit tapeworms. These are little worms that live or large worms that live in the intestines. They cause irritation, and they're observable because little pieces of the worms come crawling out of the anus onto the feces. Gross topic, but that's how the tapeworms are transmitted. We see those, and then we know that the pet has tapeworms. That can cause digestive problems for the pet, as well as irritation around the anus, and that needs to be treated.
Now, a novice at this, but obviously I'm no veterinarian, but automatically I just think you get a flea collar and everything's fine?
Well, used to be there is a flea collar now that's a little different, but the flea collars didn't work very well, and that was the problem. We had the whole topic of flea control has changed. When we started out 20, 30 years ago, flea control was really difficult. The products that we had didn't work well. The dogs had to be bathed and then dipped. It had to be done every week or two, or the dip wouldn't last. The dips were very toxic. If they were used on cats, a fair number of cats would die, and that was the approved product. Now we have much safer products that last longer and are much less expensive. The other thing that used to be done is they used to bomb the house. They used to vacuum bomb the house, set off bombs that were moderately effective, had to be repeated every month. It was an expensive project to do a whole house. Now we have a different idea. The idea is we'd like to get a flea trap, something that produces heat, produces carbon dioxide that fleas are attracted to, and produces vibrations that they're attracted to. And we have one of those. I've got one here called a flea trap. It's a dog. The fleas jump on the dog because he's producing carbon dioxide, he has body heat, and he moves. The fleas jump on him, and if I've got a good flea product on him, I can kill that flea. So now we're using our dogs and cats to catch fleas and kill them.
Okay, and these are these the top products?
These are the top products that we have. There's a number of products. We can't carry all of them. But this is a good representative sample of the not only different kinds, but also the different ways of applying them. So this is the first one I'll mention. It's Capstar. It's a oral medication. You give it kills the fleas almost immediately, and it works for about a day or two. Now that's nice if you think your pet's had a flea exposure. You took them out in the woods and you know there are fleas all over the place. You give this, it kills off the fleas. You won't have to deal with them. It doesn't do anything residual, though. So if you have a problem in your house where the fleas have already begun to settle into your house, or your yard has it,
right back.
You'd have to do it again every day.
How about preventative, though? Is there anything to stop?
Yes.
Okay.
All right. So now you're getting into the flea life cycle. So to understand how we go about controlling fleas, we have to know something about fleas. The flea jumps on the dog, the adult flea jumps on the dog or cat, lives there for a year, mates, and produce eggs. The eggs fall off the pet onto the ground, typically where the dog is hanging out. If the dog or cat sits there for a while, they'll shed flakes, and in addition, they'll shed some of the poop of the flea in that spot. That's food for a baby flea. So here we have these eggs on the ground with these products that have fallen off the dog or cat, and they're sitting in a secluded spot. The egg hatches within a couple days, develops into a little larva that crawls around, it's microscopic, and it eats those products for about 2 weeks and then forms a cocoon. That cocoon can sit for up to 2 months waiting for a pet to come by. When it picks up the heat, vibrations, and carbon dioxide from that pet, it hatches and jumps onto the dog, and then the life cycle repeats. So what we want to do is kill the flea before it can reproduce. Right. Or kill the flea once it jumps on the dog before it gets a chance to reproduce.
So I'm assuming we have some of those products right here. What are those products?
We do. We have Advantage 2 over here and Canine Advantix. The difference between them being that the Canine Advantix kills ticks as well as fleas, but we're not covering that. These products are put on the dog. We get a little vial from there. We just squirt it right between the shoulder blades, and then we usually put it in 2 or 3 spots down the back. And it lasts for a month. You reapply it once a month. Very, very effective at killing fleas. Because no product is 100% effective, there's other products as well. There's Frontline, which is similarly applied once a month. There's Advantage Multi, which is used not only to kill the fleas, but also to prevent heartworms, which is another problem. It's more convenient for people who don't want to give a medicine for heartworms and a medicine for fleas. Right. Finally, we have NexGard, which is an oral medication. It's given once a month, also kills fleas and ticks. Instead of applying it on the skin, some people don't want to do that, or they don't want the exposure from the skin. Say they have little children, they're worried about some exposure. They'd rather give something oral to the pet. That's oral. And then finally, we have a collar. We do have a collar. It's an 8-month collar. It's the longest acting insecticide we have. It's put on the dog. It has to be put on properly to work. That's the only problem with it. But if it's put on properly, it's very effective. It lasts 8 months. Very, very safe. And the final thing we have for little animals that are really, you're worried, they're babies, they may not be able to handle any insecticides, or you have something that's sick and you're just worried about using an insecticide, we've got flea combs. Okay. Flea combs, you just take it right through the skin. Usually you use a little diluted baby shampoo first to soften the fur, and then you just go through with the flea comb, pull out the fleas, but you better be ready with something in a little bowl, like a bowl of water with soap or alcohol or something, to dump the flea in, because it'll jump off of that onto you or back onto the pet.
Let me ask you something, and obviously it depends on your budget. Not everybody can afford it, but is it better to have hardwood floors or tile floors than carpeting?
Yes.
It would be easier to control fleas if you do have that. Of course, you have other reasons for having rugs on your floor. But yes, it's easier to control that. However, we don't bomb houses too much now, because we now have the pet basically walking along, picking up all the fleas as they mature, and then killing them off. So if you want to speed it up, our feeling is just use a good vacuum cleaner. Vacuum very carefully, especially crevices and corners, quiet areas, say between the cushions on the couch. You want to get that little suction device that goes.
The other thing I tell people when they're vacuuming and they don't realize this, you vacuum. If you can do it every day, it's the best if you're infested. If not. But I tell them when you're done, unplug it, take the end of the vacuum off, the part that's on the floor, wash that in hot water, rinse, because you're sucking up all those eggs and fleas. Sure. Otherwise, you're putting it back in the closet and they have a flea party, and then you come back and you vacuum. You start spreading them all over
again.
So you take it out, unplug it, and wash them off and blow dry it.
I want to talk about the flea collar. What makes that so much better than one, say, 30, 40 years ago?
Well, it's a different product. This is those were organophosphates typically, which had a shorter lifespan. In other words, they wouldn't last as long, and they were more toxic. This is flumethrin, which is a much safer product, and it lasts much longer. This is an 8-month product. And imidacloprid, which is the same thing that we use in Advantage, very, very safe product. So this one can be used on cats or dogs, unlike those other ones. The only trouble with this product that I can really see is twofold. One, if you put it on too loose, it doesn't work well. And the other problem is if the dogs play with each other, if you have two dogs and they play and they pull each other's necks, they'll tear the collar off and it won't work.
There you go.
So that's the problem, and it's not cheap. The company, all these companies want, if possible, at least initially, to get it from a veterinarian. And the reason they want you to get it from a veterinarian is, one, especially something like this, they want it applied properly or it doesn't work. And so they want people instructed properly on how to use them. The other reason is that if something fails or there's a problem, they want to know that a veterinarian's backing it. And you can go for help.
We've got about 90 seconds, so I want to go to each of you real quick. We'll go to Bernadette for allergies. One last word to tell the viewers about allergies and what they should look for and what they can do.
Wow.
No, I know. You're telling you to talk in 45 seconds.
Basically, if your pet is itching and uncomfortable, it hurts them, bring them to the vet so we can find out what's going on and we can give them relief, because it really is uncomfortable and painful for your pet.
And the same question to you this time, though, dealing with flea and tick.
Fleas, you want to jump on them right away. The biggest thing is you don't want to quit early. Fleas are biggest in August, September, October, and November. People think of them as a spring-summer problem. They're more of a summer, fall into winter problem.
And is this something when you bring your dog in for your a normal visit, you guys check for this anyway?
If they're there, we'll see them, because the animal will be biting themselves and ripping fur out.
You'll notice it right away.
Oh, we'll see it.
Well, I appreciate you guys coming in. It's kind of nice to be in this chair and talking to you guys like this.
You.
I appreciate it. And AJ, great job. There you go. Say hi to everybody. Dr. Spectors, thank you very much. For all of you out there watching, thanks for watching, and we'll look for you next time on Pet Talk with Dr. Lou.